So this meeting, Sumner County Health Human Services, as we were meeting to order. Roll call.
Dale Schluter,
Yeah.
Reed Schumann, Chuck Van Etten,
Here.
Dale Olson,
Yes.
Don Pettit, Lorraine,
Here.
Jennifer Kabornik, Carol Pearson,
Yes.
and Dr. Dunlap, present.
We have a quorum. Certification of compliance with open meeting laws, I believe Glenn took care of that. Meeting agenda, any changes?
No.
Motion to approve the agenda as is.
So great, Mr. Chairman.
Second.
Sure.
Thank you. Those in favor say aye.
Aye.
Opposed, same sign. Do we have any public or public comments? Committee reports. Approval of minutes in last week's.
And I would, I looked them over, they look fine to me. I make a motion to approve, Mr. Chairman.
Second. Those in favor say aye.
Aye.
Motion passed. I didn't accept. Okay, now, committee reports, Lorraine.
Yeah, I'm gonna start with our Community Health Center report. LCO Community Health Center tested 25 patients so far this week in 2 days. LCO Community currently has 5 active COVID-19 cases. 3 of these cases were tested positive today. 3 are from the same family. We had 2 positive cases yesterday. Last Wednesday and Thursday, we had 0 positive cases. We tested 45 patients last week for COVID-19 with 15 positives altogether. Remember, the best way to avoid serious complications of COVID-19 is to get vaccinated. LCO Health Center has given over 11,000 COVID-19 vaccinations. About 65% of our community is fully vaccinated.
What percentage?
65.
65.
Positive cases are heading in the right direction. I want everyone to continue to follow CDC guidelines for COVID-19 response. We observed a large increase in positive cases of COVID-19 last March. We want to avoid that this year by wearing a face mask within 6 feet of others except in your own home. Avoid large social gatherings. Try to maintain 6 feet from others in social settings. Wash and hand sanitize hands regularly. And then call LCO Health Center to schedule your vaccinations. And we have increased the times that we are vaccinated, so we still have that for the people. I do want to acknowledge that we have our Head Start program up and running now again because we had to close because of all the COVIDs and all the things we were seeing in the families and community. So now we're up again and daycare's open again, so we're trying to monitor and keep a close eye on any of the health concerns that may rise and pulling back when we have to. But the kids were happy to be back to school. They're engaging now, and we want to support them any ways we can because it helps their mental health too and their ability to continue learning. So,
I'm requiring proof of vaccination to go to Head Start to go to.
not yet. I was hoping to, but not yet. No, it didn't go through, but we are highly recommending it. At our clinic we did, and that's how we kept our doors open during this whole pandemic. And so we strongly encourage those who aren't to get vaccinated because it's affecting all our businesses and all our entities for us to try. We are pursuing a new health center facility, so we're going to the next steps now so we can get that building and project underway soon. We are also moving forward with our housing project because we have such a high homeless rate and try to meet the needs of the people who don't qualify for low income housing but need housing too. And so we are trying to establish a new housing community, and it'll be like 20 homes there and an apartment building to help those who are single parents, are single and you know what I mean? And
Seamless.
need a place to live. So we're going to be pursuing those projects also. Our elderly center, we are moving forward with that project. They have cleared the area now where we're going to be building, and now we're going to move forward with that also. So we'll have a bigger facility for our elders, located in Reserve, one of the villages there, and it's kind of centrally located, all the other villages. So then we are going to be adding more programming and more support services for the elderly unit. And we just got a new van for our program, so we'll be able to help deliver more meals out in the community, so the villages that are around that continue to need that support. We are also within our homeless shelters, we're trying to run into bumps here and there, so we're trying to work through the issues as they rise. But we're trying to bring in more services for the people who are in need, who not all of them do, but there are those who do need help in certain ways for mental health or AODA, whatever issues they may be dealing with. So we're trying to make those connections stronger with any of the people in the men or women's shelter and the families who need that support. We are also working on educating more prevention with our younger people and our families and community, so that we are building on our cultural activities and more engaging them in ways of learning those teachings and learning the seasonal, whatever activity it is that traditionally is traditional for our people. So we are building on those ways for more prevention, intervention, and educating them. So we want to keep educating them. And I've seen that in the survey that things we're going to keep doing is educating them so they learn the dangers of AODA, issues and where to get help for mental health. And we've got a lot of families that are broken families, and our single parents, our grandparents, or others who have had to step in now because of the drug epidemic we are experiencing. And so we're trying to help support things all the way around. So we continue to we're building on that also. And again, we are continuing to send our people to get the care they need for those addictions, and trying to give them the help as quick as we can. And again, intervene as quickly as we can. So all those services we're trying to build on. And, but we've got so many things going on, it's hard to keep up on everything, but we're trying to address things across the board, what we're seeing and experiencing. But it's so good to see those numbers coming down now with the pandemic, and trying to help those who are dealing with that sickness to heal as quickly as we can. And again, vaccination, the county made a difference for a lot of them, and they didn't get as sick as they could have, possibly would have died from that. So, but I think that pretty much covers some things we've been working on.
Thank you.
Thank you.
Ms. Pettit?
Chairman, I just wanted to let the record reflect that I had trouble logging on. I got on at 6:33, so I have been present and heard Ms. Bougier's report. Thank you so much, Lorraine, and I know that it's a great loss of many on the reservation at this time and the surrounding area, and it's very devastating for many of the families.
Yeah.
I'm here. Thanks.
Thank you.
And I'm glad you mentioned that, because the other thing at the college setting, mental health, getting more mental health for our students who are going to school, because what she just shared, all the losses we've experienced, it has impacted so many of them, and we want them to get their educational degrees, whatever they're working towards, but that support was needed. So we're going to keep building on that. But getting back to the health piece, we really got to watch things in our community all the way around with some of the latest sexual transmitted diseases, syphilis, and HIV. So the numbers that have been seen, we gotta keep that awareness going out in our community to keep our people protected and safe, because it's out there. And more of it is coming in, so we just gotta keep that awareness. And
Did those numbers go up during the pandemic?
yeah, they have gone up. They have gone up. I would say within the last 6 months to a year.
Yeah, syphilis has really risen. And we would see maybe 1 or 2 cases. I'm pretty sure we're up in the high teens
Mhm.
in syphilis cases, so. We think it's related to also sharing needles.
Yep.
So,
Yeah. But I wanted to bring that to here tonight too, so we can keep that awareness and
mhm.
have remind people to be safe. Thank you.
Okay, thank you. Is Joey online?
Yes,
Nope.
I'm online.
Go ahead, Joey.
Okay, everyone should have a copy of the report. I'll start out talking about the Meals on Wheels drivers. Again, the greatest need for Meals on Wheels drivers is in the Hayward area. Unfortunately, because we haven't been able to fill those spots, we are now only delivering hot meals on Monday, Wednesdays, and Fridays. And then on Mondays and Wednesdays, everyone gets a frozen meal for Tuesday and Thursday, because every Tuesday is soup day, and that's difficult to transport and freeze and different things like that. So we've now switched just for the Hayward area. Soup day will be on Monday, so those people that wouldn't get the meals on Tuesday would miss out on that. So we've switched soup day from Tuesday to Monday, and we're hoping that this shortage will end when the snowbirds come home and drivers feel comfortable driving in the winter again. And we still have a lot of people that are fearful of COVID and don't want to drive, don't want to deliver meals. So it's caused kind of a big crunch here in Hayward with not having enough drivers so that we can go out all 5 days. So we've switched to the hot meals Monday, Wednesday, and Friday. Then a frozen meal also goes out on Monday and Wednesday for those Tuesdays and Thursdays. So then in turn, because we don't have a lot of volunteers, because our typical volunteers aren't coming in because of COVID, the fear of they're going to get it from someone else, they just don't want to go out. So now staff comes up then on Mondays and Wednesdays and packs those bags and gets them ready for the drivers. So it kind of puts a little extra work on the drivers also on Monday and Wednesdays. So instead of having 2 bags with hot meals and 1 cooler with frozen, they now have 2 bags with the frozen meals plus their other 2 coolers of hot meals and another freezer container with the cold meals just for that day. So our routes are taking a little bit more than that hour and 15 minutes. They're more running like an hour and a half, but we've got them pretty much labeled. So when I did the bags on Monday, I labeled the Tuesday meals with the bags that had the one that had special. We have people that are diabetic, don't get milk, different things like that. So they were in separate coolers, so they didn't have to dig through and look for those special names on bags. The other thing that we're in great need of is a bus attendant and a part-time bus driver. We have lost both. So unfortunately, because of that, as I've talked about before, the bus is only running Monday through Thursday, the regular hours, 8 to 4, and then on Fridays just till 1, because we don't have that other person to relieve the other bus driver that typically works 9 hours a day. So we're still in need of that substitute bus driver and someone to help on the bus. That assistant is so important because right now, the top 2 things that we're doing with that bus right now are our medical appointments and shopping. In this last quarter, 4th quarter, of the rides that we did, and we'd had 499 hours of service, 439 of those rides were for medical appointments and 341 were for shopping. And of that 439 medical appointments, we had 128 of those riders were in wheelchairs. So those wheelchairs, once you get the person on the lift, get them in the bus, tie them down, instead of having 15 minutes between scheduled rides, we're having to do anywhere from 20 minutes or more. So the bus driver is typically running a little bit behind on getting people to those rides. Our medical appointments have gone up for a couple different reasons. One, we have the hospital calling us from Water's Edge and assisted living, taking people to appointments. So those numbers have gone up. I would say on an average, we probably take 2 to 3 calls a day from either places like Water's Edge or Harbor Living or some of the other places where we're transporting their individuals to medical appointments. So those both have gone up. So our 60 and over for this last quarter was 779 people were 60 and over that rode the bus, with 128 of those being people in wheelchairs, and then 340 were non-elderly. And those are the individuals that we pick up and take to Ventures or take to their jobs that they have, you know, through the programs at Ventures. And in the fourth quarter, the bus traveled 3,508 miles, and it was in service, like I said, for 199 miles. And our expenses for the bus for the fourth quarter were over $18,000. And that brings up the other part of information on the bus. I'm in the process working with the Wisconsin Department of Transportation. We're looking at doing a bid process for a new bus. There are still some unanswered questions that both myself and the DOT have to get answers to. And I will ask that the Senior Resource Center bus be put on the agenda for the next Health and Human Services meeting 1 month before we do the annual report. And I will also be bringing it up at our finance and our senior resource board meetings this month, because there's some things and some information that we all have to agree upon in the process that we want to go to purchase that new bus. And right now we have close to $35,000 towards a new bus. So we've been talking to bankers and different people about acquiring a new senior resource center bus. And the Wisconsin Department of Transportation has some ideas and some things that we could possibly do to expedite getting us a new bus. Because we're on the, I would say this year, we've probably put close to $30,000 into that bus and repairs. It's outlived the need to continue using that bus. Right now, again, for the second time in about a month, we have borrowed a bus from Nemacolin Transit. We're very fortunate that they have extra buses that we can use when our bus is being serviced. So we really appreciate the gift that Nemacolin Transit gives us all the time for letting us use a bus when we're in need of one. We're still looking for an assistant cook in Stone Lake and an excellent, and of course, we're still looking for a site manager for the winter site. Stone Lake and Excellent are up and running. Winter is not up and running yet because we need that site manager. Right now, all the meals for winter are coming out of Excellent, all the home delivered meals and the carryout meals. Last month in January, the average number of meals that went out to winter for the month were 20 a week. Excellent was 17. Hayward is always high at 75. Stone Lake was 22 on an average this time of year, which there's not, the numbers go down because a lot of the snowbirds are gone. But the average number of meals that went out daily from all of our sites was 134. And in the month of January, we served 2,863 meals. If we stay just at that level, again, we will serve over 35,000 meals in 2022, but those numbers will go up. So we're projected probably to hit close to 40,000 or more meals that go out to seniors in 2022. And then the other thing is, the second thing on the agenda is the MOU that we can get to when you're ready to get to that point of the agenda, unless anybody has any questions for me.
Say hands up. Yeah, Marie.
Joey, we are trying to coordinate CDL training for our community. So keep an eye out for that, because we want to do it for the whole community.
No, that would be really good, because that's one of the things we don't require our bus driver to have a CDL. We prefer it. And when we borrow a bus from Nemacolin Transit, only a driver that has a CDL can drive it. So our goal is to hire someone with a CDL, or hopefully they, they can get one. So that's really good. So Lorraine, when that comes out, I'll watch for it, but if
Yeah,
you
keep an eye
see
out.
it, send it my way.
Yeah.
Thank you.
Okay. Let's go into the memorandum of understanding. Joy, are we still there?
Yep, still here.
Did you want to talk about the memorandum of understanding?
Sure. At last month's meeting, we talked about some possible changes in the memorandum of understanding. So I went back and I talked with John Schnabel, the OAA person from Guar. And he thought, and we looked at, he said, kind of the changes we were making, we already were supposed to be doing it. Why say we may do it or not? And then we had our board meeting and we decided to leave as is. So highlighted is number 4, the Senior Resource Center will include the following services and programs for the seniors of Sawyer County as scheduled, staffing and funding allows. That Guar approved that, said that was fine.
Does anybody have any questions about the MOU?
That was my change from last month, Mr. Chairman, and I'm
Right.
fine with that.
Okay.
Yeah.
Okay, we have a motion to approve the MOU now then.
So moved.
Other concerns, questions? Everybody in favor, say aye.
Aye.
Opposed?
Aye.
Okay, motion passed.
Okay, so it just needs my signature and Tweed's signature.
You're up.
I am up. Hello. Today we have a presentation. We have 2 people with us to help with this. It's our community health improvement plan. We completed that assessment throughout this spring and summer and fall. And we have on Zoom with us is Sherry Morgan, Marketing and Communications Director from Hayward Area Memorial Hospital. As you recall, the last time we did the community improvement plan, we did that with Hayward Hospital. And this is our second go around as doing this together. So Sherry's on. And then we worked with Claire Janty. She's a physician assistant and master certified life coach. She was brought on to help facilitate us through this process. And she brought a very independent and unbiased perspective to this and helped us really garner a lot of information. So we have a lot to go through. We've done this with the hospital board, so we should be hopefully pretty smooth. We'll wait for questions until we get through so that you can kind of hear it through. So Claire is on the line. Welcome, Claire.
Yes, thank you, Julia. So I know that there are many other things on your agenda, so we're going to go through this slideshow, giving you a broad overview. So the agenda is to talk about the mission statements of the organizations, the process, the vision, what our priorities were, and the timeline, because this is for the fiscal years of 2023 to 2025. So the mission statements of both the hospital and public health involve health. Improve the health and well-being of the people and promote self-sufficiency and general welfare of the individual and community. And that's what this health improvement plan is partnering with the community, because public health and the hospital cannot do it all. We need to work in conjunction with the community. So the community health improvement plan is something that has to be done every few years, 3 years for the hospital and 5 years for the county. And so that is why we did it together. And in this slide, you see the ranking of Sawyer County among all the counties in the state of Wisconsin. Sawyer County ranked 68 out of 72 on health outcomes. And that has to do with length of life, quality of life, clinical care, and access to care. And then when it came to health factors, Sawyer County rated 66 out of 72. And health factors have to do with socioeconomic factors such as poverty, poor housing, food insecurity. We know from the census data that 26% of under 17-year-olds live in poverty in Sawyer County, and it also has to do with health behaviors. So from the CDC data, we know that 24% of the population is smoking, about 35% of the population is obese, 27% have diabetes, and about 25% are inactive. So there's a lot of need, as you can see. So when it comes to the process, what we, Sherry compiled a digital survey, and this is the second time that this has gone out. We had over 770 responses. It was done digitally because of COVID. However, there were 200 that were printed and sent out with for the seniors who receive Meals on Wheels. We also sent a digital survey to a small company, but had very poor response, but in general, good response. And then we had to look at those what populations didn't we not cover in this survey. And so those are the groups that we had to have focus groups. And so those were seniors because they were maybe not so tech savvy. Young adults were underrepresented by about only 3%, and they're about 17% of the population. Vulnerable adults, and by vulnerable adults, we're talking about those who are disabled, hearing, mentally, chronic mental health, dementia, post-treatment, and also the Native American population had a 4.2% response rate, but they are 17% of the population in the county. And then we had to talk about the synthesis of those priorities and plan some actionable steps. And so these are the questions we asked. What could be done to improve the health of the residents of your county? What is preventing the residents of Sawyer County from achieving optimal health? And where should we focus our efforts? And we had over 50 pages of comments on the digital survey. And in the written report, we have selected 2 pages of comments. So on the community results, we already talked about these demographics. On the left there, the ages and the ethnicity. The gender, 70% were female respondents, 30% male. 68% had the Hayward zip code. And 75% of people had training beyond high school. And in the digital survey, the top 3 issues identified were alcohol, drug use. About 86% of the respondents picked that as number 1. Number 2, mental health, about 7 out of 10, and chronic disease, about 1 out of 3. And when we compare the results of the survey from 2021 with 2018, those top 3 spots are the same. And then we went on to do a SWOT analysis, strengths, weaknesses, opportunities, threats, and challenges for those focus groups. So in this next set of slides, we're going to go through some of those. So the strengths were the walking trails. People thought there were a lot of resources, however, not everyone knows about them. And so you'll see that come up later as an actionable step. Lots of compliments about the medical resources and reaching out to the community. On the next slide, people commented about Sawyer County doing a good job with the vaccine distribution and cooperation between medical and law enforcement. And then when it came to the weaknesses, lack of mental health services, and also on the third point there, healthcare is crisis driven, and this was very good for us to know because you'll see prevention and education as part of the action plan. Primary provider shortage, and that's a rural America problem, not just our county. And at times culturally insensitive healthcare. And this was kind of dovetails into trauma-informed care. You know, we're talking about people who might have had historical trauma or impacted as an adverse child event, knowing about abuse or neglect in the home or domestic abuse in the home, and trauma-informed care in the medical realm has to do with having a safe environment, both physically and emotionally, having that collaboration and shared medical decision-making model, presenting the information in a trustworthy and transparent way, and empowering the patient to make their healthy choices. And some of the other weaknesses that we had was the youth wanted more after school and after hour appointments. You've already talked at this meeting tonight about transportation and the uneven distribution of services throughout the county. People identified a lack of home care agencies in this county. And even if I could afford to hire a private home care worker, they're very limited laborers available to me. And then on to some of the opportunities, more collaboration between agencies, that health education and prevention piece, including on mental health. The last three on this slide, the more affordable housing, safe gathering places for youth, and a community rec center were all very good opportunities. However, we felt they were beyond the scope of public health and the hospital, but certainly those institutions can use their clout to advocate for these among other community leaders. And when it came to threats and challenges, of course, there's always the time factor. We heard a lot about the cost of healthcare, the low household income and the high cost of housing. How much effort will it take to impact these numbers? We already talked about the geography of the county. We have to kind of agree on the priorities and what direction we should move. And as you can see, there's great need in many areas. So on this slide, we kind of summarized what the top 3 priorities were in both the digital survey, the senior focus group, the Native American focus group, the young adult focus group, and the vulnerable adult focus group. And you can kind of read there, some of the common threads were that mental health, including care for the caregiver and dementia care, and that culturally sensitive healthcare and the trauma resources. Another thread kind of related to that was the alcohol and recovery resources, and also talking about the awareness of those community resources, and then the chronic disease piece. So we had to kind of decide how were we going to make these into actionable steps. So we decided to approach it by age. So on this following slide here, for children and young adults, we're going to work on health education and prevention. So maybe we can prevent some of that obesity and diabetes. Work on education about those adverse childhood experiences, as that can lead to substance abuse at a later age. And have mental health services brought to that youth group. And then the last one, healthcare exploration for future workforce, so that we can send them away to get educated, but hopefully they will come back, because we need to cultivate that next generation workforce. And under adults, we have the chronic disease management, which I'll talk about a little bit more in another slide. That alcohol and drug recovery groups, mental health, trauma, and the culturally sensitive healthcare. And for seniors, that chronic disease self-management and dementia care and resources and mental health. And you can see those 3 areas that we grayed out, since we thought again that they were beyond the scope of this project. So now in these last few slides, we're going to talk about that timeline. So in March of this year, we're going to make public the results of this survey and post it on the website and get it out to the community. And in May, we're going to start gathering the information for that resource guide. You know, where are the support groups? Who's the head leader? When do they meet? Where do they meet? And start collecting that. And this has an additional community benefit, because there's a lot of small businesses in Sawyer County, and they could use this as part of an employee assistance program. And then in the fall of 2022, we're going to create these community action groups and focus on an action item. And this is not reinventing the wheel. This is working with already health champions maybe that have identified themselves for each focus area. And we're going to let them decide what do they want to concentrate on, how fast they're going to move on that. We hope these groups could be geographically diverse and also diverse in backgrounds and life experience. And they could come up with having an informational campaign. They could come up with a health challenge. And in year 2, we're going to explore offering chronic disease management support groups using the Stanford curriculum. The name of that curriculum is Living Better with Chronic Disease. And this could be for young adults through seniors, and it could be disease specific like diabetes, or it could be skill building like medication management, or how to talk to your providers, or stress management with chronic disease. And we would share that community resource database, and then we would have our first community health challenge. And then in year 3, we're going to look again at our action plan and our priorities and what is the next best step for us to take, and also begin working on our next community health assessment needs, which would be done in 2026. So we're open to your questions and comments. And then one more slide on this has all the resources for additional information if you want to read about it.
Stop sharing. Okay, a lot of information, went through it fairly quickly. You have information in your packet to refer back to, but open for questions for Sherry, Claire, or myself about the process, about moving forward. And then before we're done, we just kind of need the go-ahead that yes, this is where we agree that we should be moving to.
While I applaud all the work that went into this, and it's a Sawyer County plan, it is pretty easy to get Hayward-centric. The Exland and a lot of winter folks relate more closely with Ladysmith. Stone Lake can be Hayward, or it could be Rice Lake. You know, there's a doctor's office in Cable. I think it's important that we make sure we branch out and have that information available. So it's for the entire county, not just Hayward.
So as we're garnering those resources and pulling all that resource data together, make sure that it's inclusive of surrounding counties that people might go to.
Absolutely.
I just want to reiterate. Okay.
Yeah, and I noticed one of the things was available transportation. I think we've really done a yeoman's work on with the Namakogan Transit, getting people from hither to yon, and hopefully we can work. We do have a new mobility manager,
Okay.
and they work together. If you have an appointment that you can only go to Duluth for or Ashland for, sometimes they can actually work things out where it might be switching buses, but better than having to drive there yourself.
And that could be part of, as we garner the resources, one of the things that we had talked about was there were probably more resources out there that people don't know exist. So that's why we want to make sure that that's all pulled together, and gathering that just that kind of information is what we want to pull into in an area. I didn't know about that either. So thank you for pointing that out.
Thank you.
These last 2 go-arounds, they talk about the lack of mental health services. What I don't know is with the therapists that are in the area, are their schedules full? I mean, what does that mean? Because you know, if you're almost 30 years, it's changed, but when I first came up, there were only 2 or 3 of us in your town doing, and plus the LCO had some therapists. There seemed to be a lot more. In the last couple of years, I think some people have left, but there's still way more up here than when I first moved here.
I think you're scheduling out till end of March right now.
Oh, you okay?
People who appointed, and I can just speak for North Lakes, which
Okay.
is like and that's not just North Lakes, it's because people, when they're full there, they look elsewhere. But a month ago, you sent someone up to see counseling, they're getting appointed for March.
Okay.
So
And that is, just to kind of speak to that, that is one of the things that we want to assess. And we're looking at, okay, how, we know we're not going to change the ranking in 3 years, but how do we know that we've made those steps? So we know that we want to do an assessment, how long does it take to get appointments, and then keep assessing through so that we can see whether we're making any headway.
Well, who are you working closely with the tribe?
Depending on which projects we're going to pull together. When we had our meeting, we had housing, we had home visiting, healthcare center. I've been, I forgot, the doctor's
Head Start.
does medication assisted therapy.
Dr.
Yes,
You
thank
know
you.
Yeah.
Yeah, so reaching out to a number of people depending on the resource, but if there is one person that might be ideal for that. The other thing that I just learned about is this next go around, I think the tribes are going to be required to have a community health improvement plan,
Mhm.
and maybe we can do that all together
Yeah.
so that we're all moving in
Yeah.
the same direction, but
Yeah.
despite that. So if you
That'd be
have some
good.
names, Lorraine, you want me to reach out to, let me know.
Did you work with Marie Basty?
Don't think so.
She's the behavioral health director.
No, not yet.
Yeah.
When I went to visit and she wasn't there the day that I went in there, but yeah, thank you.
Be good too, yeah.
Julie, I was impressed when I went through and saw the list of all the outside county entities that you did bring in here to work on this. And you just mentioned something about standings. Are we losing ground? Are we holding our own? Are
I-
we gaining a little?
Think we've been, well, actually we gained, and actually Sherry, you're more familiar with the long-term data. I think we gained a little bit of ground in one area, correct?
Correct. Yeah, but very little. We've been, in my time, 11 years, we've been toward the bottom, 69, 70 in that time. So 68 was a little bit of a gain.
Well, it's better than going down.
Yeah.
Because we have a lot, like we just heard, there's a lot of barriers.
Mhm.
So
Mhm.
any further?
Well, I thought it was good.
Okay.
We're hitting a lot of areas we need to hit.
So- We're excited to work on this. Claire really helped bring us and get it's overwhelming when you collect all that data, and she really helped us kind of get us in some pockets where we think we can work specifically and not have it be so enormous, and then just keep chopping away at it.
Mhm.
So are we,
You need a motion.
I don't know if we need I think we should just take the motion on approving this to move forward.
I see what you're saying.
I will move to approve the plan to move forward.
I'll
Did you
second
need our
that.
approval or did you need that we accept it?
I think I think it's on approval. Do you remember, Paul? I know the board, I know the hospital has to have an approval, so we should just go forward with an approval.
If we approve it for somebody else, so it has to go to full county board then, doesn't it?
Oh, it does?
If we're doing it for somebody else,
Or somebody else?
is in the hospital?
No, the hospital
No,
does
no, this is
their own.
ours.
Their own.
This is ours.
This is ours, like, this is
Right, I-
ours,
I
we're doing
understand
it
that.
jointly
You
with the
said-
hospital.
Okay,
So their board approves the plan. And we approve the plan to move forward. Or however you want to do that.
I'm not sure if we need to take this to the full county board or not.
I don't think we did with that. The last ones, we haven't.
Yeah, I didn't think
It's just
so.
a matter of this group.
It's this
being-
board.
Yes, this
Health
board.
and Human Services Board.
Yes, yes,
Is approving this.
yes.
I have a motion to that effect. Okay.
I'll second.
And Lorraine, any further discussion? Everybody in favor, say aye.
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 Opposed?
Very informative.
Very.
Okay, motion passed.
Okay, thank you, Claire and Sherry, for
Yes.
joining us.
Thank you all.
Yeah.
Thank you.
Takes us down to admin now.
Have to do COVID health.
Oh, I'm sorry. Yes. I'm thinking I'm all done. Actually, I don't need to go through the slide deck. I update as you look through the slide, the numbers were starting to go down, and I think we were at like 113 per 100,000, or maybe it was 130. I can't remember last week when I wrote that, but we're down to 56 per 100,000. The positivity rate about a week ago, yeah, it was 100 and whatever that is, 130. I can't see that far. Positivity rate on the 19th of January was 34%, and now we're down to 11%. So that's really good. And we were averaging 30 tests a day, and we are down to averaging about 11 tests per day. So tests have definitely gone down. So everything is moving in the right direction. And then just the last update is we're working on a testing plan for the week of Berkey. We don't want the hospital to be overrun by people trying to come in to get tests from either the emergency room or urgent care. That does happen already, but with all the people here from Berkey, we're just working on a plan to keep everybody away from the hospital. If they need tests, it'll be either out by Oasis or North Lakes, and have testing for people that are coming into the community if they need it. And that's my update.
Julie, you said it would be at Oasis?
We are at Oasis right now. That's where our
Oh, you're
community
still there.
testing site
Okay,
is. Yeah,
okay.
we're still there. So
right.
kind of working through trying to decide if we need 2 separate sites. We were going to do 2 separate sites, but now our testing's gone down so much. I'm not certain that we do, and we might be able to handle everybody at one site.
Do you know where the Berkey's ending this year?
We're
Where it ends?
always ended.
Oh, didn't they change that last year?
They,
I don't think the ice was safe.
There was a different route, a different,
oh,
The lake. or not the
yeah,
lake,
there was something different. Are they doing that again this year, or?
I thought the route was back to the original
Is
route
it?
from the last, from everything that
Okay, I didn't know.
I had heard from them.
Because that made a difference last year, I think, with the congestion, the, you know what I mean, the amount of people. But I didn't know they were gone back. Okay.
Yep, haven't heard anything different than the,
right.
back to the original. Okay, that's it for me.
Thank you.
Thank you.
What a drop. That,
Yeah.
Mhm. Nice,
Oh.
going in the right direction.
Yeah.
considering we've got 100,000 people around here. Where are we at now?
The long term.
Thank you.
Yeah, Lori has her report in front of you. I want to highlight a couple things. Excuse me. One is that we talked about that guardianship policy last month, and some of the issues with the comprehensive evaluation. Lori and myself, probate, the judge, met since then, had a really good meeting. There's some other things we have to work out, but the communication is there, and it was a very positive meeting.
Good.
The other one is, we talked about potential, the ADRC perhaps going over the Oasis building, and then Mr. Olson brought up Veteran Services. Within the last month, we've been over there multiple times, and with Gary Elliott from Veteran Services, talking about how we might be able to be in there together. So they're going to start doing a remodel and stuff in there. We're going to be in there with Gary for a while, but the short-term solution will work with us all in there. The long-term solution would be for in 2023, they take half of the other side of the building, and that will work out real well. So the plans and the setup, we've had lots of conversations with Tom and Tim, and Gary and Lori, and we got it all laid out, and it's like a pretty good plan.
Good.
And Gary's gonna have to get in there sooner because they gotta start doing some work on his building or shutting off the gas or something. So they're gonna work on the corner in the building where he's gonna be at so they can get in there, and then they'll start working on the part for the ADRC. So the priority is to get him into that corner.
And our stuff's moved out now.
Yeah.
The girls, they went there
You
yesterday.
build, it's gonna take him a while.
Well, it's good we're utilizing all that.
Yeah, it
It is,
is.
it's
It
great.
is. Doing-
It's a wonderful setup. It's just,
So
Okay.
who's in the other half now?
that day treatment
Journey.
program.
Mhm.
They're renting that.
And they're gonna be gone.
Well, we would have to.
Yeah. Okay. That's Gary. Public safety, Gary had some current concerns that there's gonna be kind of a shortage of space if they didn't.
It's, we can make it through the rest of the year.
Oh, yeah.
We're gonna be able to do that.
Temporarily,
We've,
that's fine,
it's, yeah, but
well,
on the other side, no, he doesn't, he doesn't need the whole other side. He doesn't need that whole space. There's plenty of space for him. Whether he's gonna cover that other entry area. But it's,
It's working.
yeah, it's working out. Yeah,
Thank you.
it's working out real well. Thank you for bringing that up.
Mhm.
It's a good conversation.
No.
No,
Youth justice.
like that behavioral health. Yeah, Alicia's report, a lot of it's the same, just want to highlight, which may be a low light, the electronic health records that they got funding from the coordinated services team from the state. We're not so sure that's going to work and do what we want them to do, what we want it to do. So Alicia's working with them to see if we can work the bugs out. We're not, at this point, we're not real confident it's going to work. It's not going to be any better in the system that we had right now.
Child protective services.
You have the caseload report and you also have the substitute care report, the placements. And youth justice, you have the caseload as well.
Okay. Any questions on any of those? Economic support, you have the report, right?
Yeah, economic sports rolling along. I don't know if it's on your report now, but there was they have so many different services in there that they sometimes have to have some of the workers who want to work full time. I mean, extra hours overtime. They don't need those hours right now, so it's put on pause until it gets going again.
County card report. That was in the packet, so
Yep.
that's quite a savings for the county. Any future agenda items? Any correspondence, reports from conferences?
I just wanted to add then what I was, my report. We started a energy assistance pro support for the community for tribal members in the service area. For electrical and heating.
Yeah.
So we are adding more support there and that just started now, today. And then trying to help those homes that need to have repair. That need homeowners that need to repair their homes. So we have been working on that also. Yeah, we're doing one thing at a time.
I was just thinking, my goodness. You got a lot of it.
Oh, geez, yeah.
I guess we're done.